Thank you. Yeah, thank you for having me. I appreciate it, and thank you all for being here, particularly our colleagues that are in Gaza, Dr. Mohammed and so on. Um, I mean, I think if I can build on what my colleagues have already mentioned, which I think is painting a very comprehensive picture of the current situation in Gaza, there are a couple of things that I feel are particularly important to say at this particular moment. And here I'm drawing from the most recent OHCHR report that was published 2 days ago on the targeting of the health system in Gaza and health infrastructure and Palestinian healthcare workers. And what that report has found, it's looking specifically at the period October of 2023 through to June of this year, so hasn't yet accounted for the horrific atrocities that we've seen in more recent months, including, of course, last week the end of the 80 plus days of the besieging of Kamal Adwan Hospital and the destruction of the facility there. But what that report finds, and I quote now, the attacks on hospitals often followed a similar pattern. This is looking back at attacks on Shifa and elsewhere during that several month period, involving missile strikes on hospital buildings, the destruction of hospital facilities, shooting of civilians, sieges, as well as temporarily taking over hospital buildings. Now, this is a systematic attempt, a successful systematic attempt to completely destroy the Palestinian healthcare system in Gaza. And if we recall, it was October of last year in 2023, towards the end of that month, only a few weeks into the genocide, that the Ministry of Health in Gaza announced that the health system had totally collapsed. So we have been dealing with a system in a state of collapse since October of last year. As Dr. Mohammed's already mentioned, the health system in Gaza, despite the best efforts of Palestinian healthcare workers and public health specialists, was in a really dire state prior to October of 2023 as a result of the long-standing siege and Israeli occupation of Gaza. But nevertheless, we have a situation now where, as I say, systematic destruction of Palestinian health infrastructure. Ghassan Abu Sita has mentioned several times publicly that there is research coming soon that has found that healthcare workers in Gaza are 3.5 times more likely to be killed than civilians or individuals in other professions in Gaza. That can only indicate a degree of intentionality. When we see that level of disproportionate impact on a particular professional cadre, we can reasonably infer that this is an attempt to identify and kill healthcare workers because they are healthcare workers. So systematic, and of course, if it's systematic, then we can infer reasonably intentionality. And what we've seen now over the course of more than 14 months are the cumulative consequences of that systematic and intentional destruction of the Palestinian health system in Gaza. Now, the problem that I think that we, as a wider civil society, as internationalist healthcare workers, as humanitarian organizations are now grappling with is that, if I can speak plainly, for the most part, the way that we collectively are engaging with what is happening in Gaza is still very much through the lens of armed conflict, as opposed to a genocide. And as soon as we appreciate, as I'm sure many of the people on this call do, that this is indeed a genocide, then we can understand, we can't, of course, accept, but we can understand why Israel would use a strategy of targeting the health system, healthcare workers, and health infrastructure, because this is intended to amplify the direct effects of military violence within a broader strategy of the extermination and ethnic cleansing of the Palestinian people. And this is, of course, certainly why we've seen sustained and targeted attacks on health infrastructure in the north of Gaza, particularly Kamal Adwan, because for as long as Kamal Adwan remained open with some degree of functionality, then people would be able to seek and receive a basic level of healthcare. Now, if you deprive people of access to water, if you deprive people of access to food, if you deprive people of access to medicine and other forms of healthcare, and you deprive them of shelter, you are forcing them, you are generating the conditions that you are generating rather conditions that simply are unable to sustain human life. And as a result, people are forced to flee against their will. Perhaps if I can end with one final reflection, and this is to take my reflections on, the role of civil society, the role of the kind of humanitarian infrastructure a step further. And this is to say, we have to appreciate the various ways in which genocide manifests. And I think we need to get to the point now that we appreciate, or at least understand, that genocide is occurring with the full cover of international law, of international humanitarian law. And I think a pivot needs to take place here. I think we need to start thinking about these systems and structures not as having failed in relation to Gaza, but rather that they are functioning, and in their functionality, they are failing to protect the Palestinian people. And if we appreciate that, then it becomes less a demand for adherence to IHL, because of course, the Israeli occupation, the Israeli siege, the entire existence of the Israeli state has emerged under the cover and with the full protection of international humanitarian law. So I think we need to start thinking slightly differently about the framing that we're using here, the language that we're using, and the calls that we're making. Thank you very much.